When a new client comes into the clinic, it is essential to get some basic information in the initial consult. Each clinic has different methods of screening new patients. In this assessment, we used multiple screening tools such as the PAR-Q, QET Health Clinic's initial consult and new client screening process, the ESSA Adult Pre-Exercise Screening Tool, and the Fantastic Lifestyle Checklist to find out information about the client. Once all of the screenings were completed, it was able to be determined what testing should be done in order to get baseline measurements to help create an action plan. The client is a 21-year-old female whose measurements are as listed: height 168 centimeters, weight 73 kilograms, waist circumference 75.5 centimeters. With these measurements, she was put into the BMI classification of overweight with a score of 25.9. The client does moderate exercise 3 times per week for a total duration of 240 minutes and vigorously exercises for a total of 60 minutes a week, twice a week. Primary diagnosis places the client in the low-risk category. Her physical activity status is active and her past history of exercise includes netball and road running. However, until the age of 14, she had a sedentary lifestyle. The client also has no known barriers or limitations. The client doesn't smoke, have hypertension or high cholesterol, and hasn't been told that she has high blood sugar. Majority of the exercise performed is due to her field of work as a fitness instructor. Therefore, at this stage of the screening tool, she has no risk factors. The client received a score of 0 on the PAR-Q test, meaning she has no risk factors, and a score of 86 on the Fantastic Lifestyle Checklist, putting her into the category of excellent. The ESSA exercise pre-screening tool showed that she had a score of 0 in Part 1, in Part 2 a score of 0. This shows that the client has no risk factors. The client has been diagnosed by a physiotherapist with a tight iliotibial band. This causes her knee pain when she runs. This knee pain is due to the patella being pulled laterally, causing it to maltrack. To help improve the tracking of her patella, the client needs to start to stretch out the inflamed area and strengthen other muscles around the knee whilst focusing on eccentric movements. A program which helps to correct the tightness of the iliotibial band may potentially lengthen the band, releasing some of the tension. The client has set goals for areas of her fitness that she wishes to improve on, as well as how she plans on maintaining her general health and wellness. She also wishes to improve her cardiovascular fitness and agility. A program to control a tight iliotibial band is also recommended as it has begun causing the client pain. To begin a plan on maintaining wellness and to find out which areas in her life she may need to work on, a wellness evaluation of lifestyle survey needs to be taken. This survey will give results on where the client needs to improve her wellness within the 5 classes in the Wheel of Wellness. These 5 classes are spirituality, self-direction, work and leisure, friendship and love. This test will allow the client to become aware of which elements in her life she needs to focus on in order to maintain a positive wellness and well-being. It was found that the client is in need of agility testing so that her baseline agility performance can be measured and located. This will show what type of agility the client needs to work on. By using a T-test, the client's lower body power, agility, and also her sprinting speed will be examined. Payol et al. Has found the T-test to be a reliable and valuable way of testing agility. As the client also wants to find where improvements can be made in her cardiovascular fitness, a sub-maximal objective VO2 to 170 beats per minute test is recommended, as it has been proven to be more efficient in showing true results as compared to a VO2 max test. This is because some clients may be unable to reach their VO2 max. This test will be done in multiple stages on a treadmill. The client will need to be cleared by a physiotherapist before starting this test due to her tight iliotibial band. Therefore, the client has found to have no risk factors as seen in the pre-screening tests. However, before starting tests to obtain basal results, she will be asked to receive clearance from her physiotherapist so that a sub-maximal VO2 test can be performed on the treadmill. The client wishes to improve her cardiovascular fitness and agility, as well as maintaining wellness. Before a program can be written, the client will be asked to undertake a number of tests so that the program can be made to target her goals and also meet her current physical activity capabilities.